Hi, everyone. Well, again, thank you for joining the Healthy Planning Leadership Series. Today, we're going to be covering climate change and health planning for the future. I'm Elizabeth Baca in the Governor's Office of Planning and Research, and we're really excited to have such a large group joining us today. Just a couple of logistics before we get started. One, the session is being recorded so that we can have access to this and put it on our website for later viewing. Since it's a larger group, we actually have everyone muted on the lines. However, on your control panel on the right side of your screen, we actually have questions, and we really encourage questions being sent in by text box. We'll read those, and we'll try to actually work in as many questions as possible because we really would love to have a little more interaction. Also, if there are any technical problems throughout the webinar, also you can send those in via question if there's anything happening with sound, but also the number to call for GoToWebinar is 855-352-9002. Just a reminder, this has been great. The reason that we're actually hosting these series is we got a lot of interest in healthy planning, especially with the recent update of the general plan guidelines, which we're currently putting the finishing touches on after the public comment period. We've had a couple of webinars, and we'll be having many more throughout the year on these topics. And today, all of these sessions wouldn't be possible without a really terrific planning leadership group that helped inform all of the curriculum, both from a planning and public health perspective. So thanks to everybody on this list, as well as our sponsors. So the California chapter of the American Planning Association, as well as the Health Officers Association of California provides sponsorships and credits, which is fantastic. As a disclosure, none of the speakers or the leadership committee have anything to disclose. At the end of the webinar, there will be an email to actually do a survey of this webinar series. We really encourage everyone to do it. However, if you're applying for credit, everybody who's applying for credit has to fill out the evaluation survey. And there will be an email that also comes tomorrow if by chance you're watching this as a group, which I know some folks are today. Also to make sure to fill that out by April 6th. The other thing is we actually have a LinkedIn group that if you're not already a member, we'll send you a connection to this group. It's basically a lot of folks who are interested in healthy planning and really want to be able to connect with each other, share funding opportunities, new publications, and other information. So today we're going to be talking about climate change, and this is, sometimes the discussions around climate change can be really overwhelming when we think about what we're confronting. This is from the NOAA temperature graphs, which we'll hear a little bit more about. And then the information on the right is just a Google search on climate change in the news as of yesterday. And it can really seem overwhelming when we think about how much we need to be addressing when we're thinking about how to really take action against climate change. And it can feel a little bit like this cartoon. So, it's okay to just pick one flower and start from there. But I think what's really tremendous about the group that we have today is they're going to be talking about the national, the state, the county, and city perspective, but it's also really from a place of being able to take action to really start to make these changes to create healthier and more environmentally sustainable communities. And I think in particular planning has a big role in doing that. So on that, I'm going to go ahead and introduce our speakers today. They have a very long bios, so I can't get into all of them in great depth, but I will go ahead and give you the highlights. Linda Helen is with she's the Climate and Health Team Lead with the Department of Public Health. She works there in the Office of Health Equity. Before joining the State Department of Public Health, she actually had a number of years in Mendocino County and has also served on a planning commission, which is really, I think, a fantastic experience to bring into this dialogue. Susan Stewart is, I remember the first time we met Susan, she's been really active in bringing the health and climate change voice together and done a lot of collaborative work with Santa Clara County through their Department of Public Health around chronic disease prevention, injury prevention, and has done a lot to actually create a health element within Santa Clara, and so it'll be really exciting to hear about her perspective. Gil Friend is basically, we were going to have Demetra. Unfortunately, she had a conflict. We are very excited to have Gil with us today, who serves as the Chief Sustainability Officer for Palo Alto, and they have a number of really exciting initiatives going on at the city level. And he's actually been named one of the 10 most influential sustainability voices by The Guardian, so that's very exciting. He works a lot with companies as well, which I think provides a really interesting perspective. And then Michael McCormick, who's with me here today, he's one of our own planners, senior planners in the Governor's Office of Planning and Research, and has spent a number of years really working on the nexus between climate change and sustainability. He does a lot of work around different analysis tools and leads the work for the state. And actually last year he was spending a year with the White House Council on Environmental Quality and with NOAA. So with no further ado, Michael, I'm actually going to hand it over to you. Thanks for joining us today.
Thank you, Elizabeth. It's an honor to be here and to be talking with you about this important subject. I'm going to give a little primer background for those of you that might not be aware of some of the recent developments in climate change, and then go through some of the things the state's doing to think about how do we move forward into the future on this issue. All of the things I'm going to talk about are interconnected with health, and I think you're going to see a lot of cross connections with some of the speakers later on. So we're living in a time of change. We have really significant increases in greenhouse gas emissions, and recent temperature records are certainly concerning as we think about the future. Over here down in the bottom right-hand corner, you see some of the more recent records, but in context to the overall climate and the direction of the climate, take a look at the image on the left, and you look at the historical temperature records, and it's a little concerning where we're headed right now. I think one of the things that I've decided to drop from many of my presentations is the projections around climate change, because we no longer need projections to show the direction of climate. We have the historical narrative now over the past number of decades to show the direction that we're headed in, and that direction directly links up with many of our projections for climate change. So January and January and February have set records that are very surprising from both an air temperature and ocean temperature standpoint. That being said, there's some good news. The image on the left is from The Lancet, thinking about climate change as something that allows us to do good things to improve the health of our communities, to improve how we work as society, to improve efficiency. To that end, the President's Climate Action Plan was pushed forward in 2011 to reduce greenhouse gas emissions, to reduce energy waste, to help states and cities prepare for the impacts of climate change. For example, Governor Brown and a number of the staff here at the Office of Planning and Research and in the Governor's office have, and around the state agencies, supported an initiative called the State Local Tribal Leaders Task Force on Climate Preparedness, and basically providing recommendations with 23 other local and state and tribal representatives, providing recommendations to the President on what the President could do to help states and local governments and tribal entities move forward in this discussion. Many of those recommendations, which were received and accepted by the President last year, are now moving forward within the agencies. There are a number of really important priorities in there around health and the connection between health and climate change. So if you haven't looked at that set of recommendations, I would suggest you do that, because there's also lead agencies identified in there, and you can loop back with your connections within those federal agencies to start or be part of that conversation. The last point is leading global efforts to address climate change. And as we've seen as a result of the Paris Summit, we've had some really significant shifts in how we talk about climate change nationally and globally. So here in the state, we've also been thinking hard about both the impacts of climate change and how we're going to reduce those impacts. I often like to tell people that our best adaptation strategy is significant reductions in greenhouse gas emissions, because if we can significantly reduce our emissions, we're certainly going to reduce the impacts of climate change in the future. In December of 2011, Governor Brown hosted an event talking about the extreme climate risks that we're facing as California, and bringing some big minds to the table to think about how we're going to move forward. There's been a number of events and executive orders since then that have moved that discussion forward, culminating in a sort of pretty significant initiatives last year, which I'll talk about a little bit more. One of the big ones is really the 6-bucket strategy for California dealing with climate change. So increasing renewable electricity production, reducing petroleum use significantly, doubling energy efficiency savings, reducing emissions from natural and working lands, and reducing short-lived climate pollutants. Lastly, safeguarding California, which has its own group of actions and initiatives that work somewhat independently of the emissions reduction side of things, but as I'll talk about in a second, we're really looking at integrating adaptation and greenhouse gas reductions because they are so interlinked. They're two sides of the same coin. This is a screen capture from the Climate Change Portal, which is the state's portal to our information, which is climatechange.ca.gov. That URL is going to be on the last slide of this presentation, so you can click through and link to that. So part of what we're going to do now is really think about institutionalization. We've been biting off pieces of this puzzle for a long time now as the state of California, starting with executive orders under Governor Schwarzenegger and leading through a number of legislative efforts. Much of this is culminating in the work that happened last year by the governor's office and signed into law by the governor in October of 2015. So Senate Bill 350 basically sets those the targets that were identified on that earlier map on the climate change portal. AB 1482 talks about the importance of increasing the focus on safeguarding California, thinking about climate impacts, how we work together as state agencies, and how do we work with our local and regional partners to accelerate the conversation around climate change impacts and adaptation, resilience, and working together to solve some of these big problems. Senate Bill 379 is a huge shift in how we talk about climate change at the local government level. It requires local governments to address climate risk and adaptation in their general plans and local hazard mitigation plans. This changes the conversation for local governments from a should to a shall for talking about climate risk. And I think this is a huge opportunity for a conversation with the environmental health community to engage with your local partners in developing programmatic policy around health and climate change. We're currently developing the narrative for this, and I'll talk about that a little bit more in just a second. Senate Bill 246 is also an important bill that was signed in October. This establishes a clearinghouse at the Office of Planning and Research and establishes the Integrated Climate Adaptation and Resiliency Program at OPR to help coordinate state agency actions around resilience, but also to support local and regional initiatives around climate change as well. But ultimately, we're looking to local governments for many of the examples of success and lessons learned. As many of you know that have been working locally, it is sometimes a struggle to get good policy moving forward and actually implemented. We've been doing a survey every year, skipped a couple years, but it's going to be back up and running again in about a month. But we spent quite a bit of time over the past few months collating and collecting the information on what local governments are doing around climate change around the state. If you look at the very top line around local coastal programs, if you look at the left graph, you see the impact of grants that we can have if we are targeting money specifically at a specific issue. We can make real progress in a short amount of time. All of those local coastal programs that are in process right now are a result of grants that the Coastal Commission and the Ocean Protection Council are providing to local governments to move those discussions forward. We've seen similar results from the federal stimulus, from energy efficiency conservation block grants, and other funding opportunities through the Strategic Growth Council and others. And I know we'll talk a little bit more about that later. But it shows where we are. And sometimes people are surprised that we're below 50% when it comes to greenhouse gas emissions inventories. So on the general plan guideline standpoint, we are making a pretty significant change to how we talk about climate change and health. Basically, every section of the climate change of the general plan guidelines talks about both of these important issues as underlying systemic things we need to address across the board in planning for healthy and sustainable communities. A really important piece of this is talking about the data that we have to inform some of these decisions. And so as a part of the general plan guidelines update process, we're also going to be presenting the data that we think would be really helpful for folks to use to plan for their general plans as a side tool for the general plan guidelines. I think the summary on my presentation is that we've reached a really interesting phase in how we're dealing with climate change and health. Health is really leading at many of the conversations at the state. This wasn't the case a few years ago, and it's really become an important issue that we need to deal with across the board. Public health officers, county officials, California Department of Public Health, and others are working with planning entities now to really push the discussion forward. It's exciting to see, lots more to do, but I'm looking forward to the rest of the conversation.
That's great. Thanks, Michael. And Linda, I'm going to actually hand it off to you, but in the meantime, we had a question come in, and the question, Michael, is why is there no mention of human population management, human population control in the context of climate change?
Well, I can respond to that a little bit with looking at some of the demographic information that the state of California is looking at to plan for the future. We currently have about 38 million people in the state, and by 2050, we're looking to receive about 12 million more people. So we're looking at about 50 million people by 2050. We've actually looked into that demographic information and are working with the Department of Finance to understand those numbers, where people are coming from, the birth rates, the migration rates, and we're attempting to address that proactively. And if you haven't taken a look at the Environmental Goals and Policy Report that was published by OPR last year, it captures many of our high-level programs and policies that we're discussing here, but also the larger framework for how we're talking about climate change and healthy communities leading into that 2050 number.
Great. Thanks, Michael. And Linda, I'm going to go ahead and hand it off to you. We have your slides up, and we'll let you take it away.
Great. Thanks so much, Elizabeth. I'm happy to be here, and thanks, Michael, for getting us going and framing the issue so well. We are located within the Office of Health Equity, which is housed in the Office of the Director of the California Department of Public Health. The Office of Health Equity was created by California legislature. The statute in the Health and Safety Code calls for us to work to achieve the highest level of health and mental health for all people, with special attention focused on those who have experienced socioeconomic disadvantage, historical injustice, including vulnerable communities and culturally, linguistically, and geographically isolated communities. Health inequities are differences in health status across population groups that are systemic, avoidable, and unfair. Health equity is full and equal access for all people to opportunities that enable them to lead healthy lives. Our 7-person climate change and health team works with local, state, and national partners to assure that actions taken to reduce greenhouse gas emissions, or mitigation, and actions taken to prepare for the challenges brought by climatic changes, adaptation, have beneficial effects on health while not exacerbating or creating new health inequities. So in essence, our team's work is to embed health and equity into climate change planning and to embed equity and climate change into public health planning. Both the planning and public health fields are rooted in social movements for health and justice for the most disadvantaged. During the 19th century, land use planning emerged as a mechanism to address tuberculosis and cholera, which were associated with overcrowding, a lack of sanitation, lack of clean water supply, and long, dangerous days laboring in factories. The sanitation movement that advocated for standards regulating running water and sewer pipes in tenements formed the basis of both the land use planning and public health fields. So land use planners have been working to improve health for over a century. As the planners on the webinar know, in the 1920s, the Department of Commerce published the Standard State Zoning Enabling Act, followed by the Standard City Planning Enabling Act, which established that the purpose of zoning was to promote the health, safety, morals, or general welfare of the community. Almost every zoning ordinance in the U.S. is based on these documents, and still today, civic bodies such as planning commissions and city councils must make findings that plans and projects do not harm the public health, safety, or general welfare in order to approve them. Protecting human health is also a winning frame for most jurisdictions to garner support for their planning activities. Public health professionals can get involved in the process and bring a robust discussion of possible health consequences to the table, along with data on health status and outcomes. The changes to the climate that Michael talked about impact air quality, water quality, drinking water and food supplies, along with increasing allergens, extreme weather exposures such as extreme heat and severe weather. The resulting human health impacts include increasing the risk and occurrence of asthma, cardiovascular disease, respiratory illnesses, vector-borne diseases such as malaria, dengue, West Nile virus, Zika, and more. Mental health impacts, civil conflicts and migrations, malnutrition, injuries, heat-related illnesses, and death. Obviously, not every occurrence of these things is due to climate change, but climate change has been shown to increase the risk of these health impacts. Here in California, we see the greatest loss of life from extreme heat. People have also experienced health impacts from drought, wildfire, worsened air quality, vector-borne diseases, as well as impacts to livelihoods and mental health. And sea level rise is also a grave threat to our coastal communities. In the Office of Health Equity, we recognize that the drivers of climate change and health inequities share similar root causes, which are the inequitable distribution of social, political, and economic power. These power imbalances result in systems that drive both health inequities and greenhouse gas emissions, such as our economic system, transportation systems, land use systems, leaving us with inequitable living conditions such as communities of color living in more polluted areas, and with climate change impacts such as increased heat and storms, culminating in the combination of inequitable health impacts from climate change and other health inequities. So fair and healthy climate resilience requires addressing the inequities that create and intensify community vulnerability. The capacity for resilience in the face of climate change is significantly driven by living conditions and the forces that shape them, such as income, education, housing, transportation, environmental quality, and access to services such as healthcare and healthy foods. Thus, strategies such as alleviating poverty, increasing access to opportunity, improving living conditions, and reducing health and social inequities will result in more climate resilient communities. For example, people are at higher risk of heat illness if their housing is in poor condition without insulation, with leaky windows, or without air conditioning. And both public health professionals in the field and at the health department and building inspectors and planning staff can refer residents, owners, and property managers to energy efficiency, utility assistance, and weatherization programs for elderly people or those with low incomes. People with existing health conditions such as chronic diseases and mental health problems, the very young or old, the homeless, outdoor workers, some communities of color, immigrants, and those who have low incomes or are socially isolated are most vulnerable to direct and indirect impacts of climate change. For example, employees who work outdoors during extreme heat events or are exposed to outdoor air pollution from vehicle exhaust or wildfire smoke suffer more impacts than those able to work indoors. Due to historical and continuing discrimination, some communities of color are more likely to reside in high-risk areas with greater climate threats, such as more impervious surfaces and less tree canopy. These conditions result in greater heat island effect. In Fresno County, African Americans were 8.6 times more likely, and Latinos were 4.5 times more likely than whites to reside in high-risk areas. These tend to be the same neighborhoods where residents are less likely to have air conditioning, more likely to have one or more chronic conditions, and less likely to own cars to escape from climate-related events such as extreme heat. Polling has shown that people of color are more concerned about climate change, and many grassroots groups are very aware of the risks and ready to engage with both planning and public health around climate solutions. Many of you working in public health programs already engage in strategies to improve health that also reduce greenhouse gas emissions or improve community resilience against health impacts of climate change. You already work on making walking, biking, and transit easier and more accessible, improving access to fresh local fruits and vegetables, supporting communities to get their basic needs met and live healthier lives, which helps them to be resilient to health impacts of climate change. Many of you working in the planning realm are already working to make it easier to preserve open space, forests, and agricultural land, develop more densely in already developed areas, locate transit, housing, retail, and job centers near each other to lessen driving, increase connectivity and accessibility, support energy conservation and renewable energy, promote green building and urban greening, and allow agricultural production and sales in urban areas, all of which have both climate and health benefits. So for example, if our communities are planned and built to facilitate walking or bicycling a half-hour a day instead of driving, we would cut annual U.S. emissions of carbon dioxide by about 64 million tons. We Americans would also shed more than 13 pounds per person, and 3 billion pounds overall, reducing incidence of heart disease, stroke, diabetes, some cancers, depression, dementia, and bone conditions. Cities can make sure that their residents enjoy the mental health and productivity benefits of access to nature, that urban areas are cooled, water and air cleansed by preserving or adding green space, parks, and tree canopy while increasing building density and height. Our climate investments can promote economic development and health equity by prioritizing jobs and employment training for local residents, especially communities facing inequities, including youth and formerly incarcerated people. We can reduce greenhouse gas emissions while improving nutrition by allowing farmers markets and community gardens more easily in places with least access to healthy foods. One of the concerns we've heard from local stakeholders is that our investments in low-carbon, dense, walkable communities that improve quality of life sometimes result in higher rents and property taxes that make it hard for long-time residents to stay in their neighborhoods. Our investments in livable, healthy communities can be coupled with measures to preserve and construct affordable housing to simultaneously slow the emissions that lead to climate change and improve health equity. It could be a routine part of plan and project review to ask not only will this harm the public health, safety, and welfare as required by zoning codes, but also to ask will this have a beneficial effect on equity. Local public health partners can also ask this question and can facilitate engagement of community members who will be impacted by decisions, since public health folks often have access to and relationships with communities facing inequities. Now to some concrete examples of our work. The CDC-funded CalBRACE, or California Building Equity Against Climate Effects project, is responding to the reality that climate change is happening now, and some communities are bearing disproportionate health impacts. We provide technical assistance to 11 local health departments to mobilize adaptation planning efforts. The program has developed adaptation planning tools, including a climate and health profile report for each county that forecasts climate change impacts, and vulnerability assessment reports for 11 counties that identify locations and communities vulnerable to climate change impacts. These tools are intended to empower local stakeholders to participate in development of public health climate adaptation plans that prioritize resources for vulnerable communities. The climate exposures CalBRACE is currently focusing on include extreme heat, sea level rise, wildfires, drought, and air quality. Planners can use these tools to inform development plans by locating areas that may be subject to inundation from sea level rise, or to locate high wildfire risk areas that may warrant development standards to lessen fire risk, or to see where residents have least access to public transit and to prioritize planned improvements there. These maps could also inform planning regarding where populations may increase or decrease due to migration away from climate change impacts such as extreme heat, wildfire, drought, or sea level rise. Several of the counties we work with have engaged with land use and transportation planning processes to promote health, climate resiliency, and reductions of greenhouse gases. Our next speakers, in fact, participate in the CalBRACE program in Santa Clara County. One of the BRACE projects was San Luis Obispo County Public Health Department's Outside and Slow, We Take Climate Change and Health Personally campaign. Outside and Slow highlights the health co-benefits of strategies for reducing greenhouse gas emissions that also have a beneficial effect on health and quality of life, such as walking, biking, or taking transit instead of driving, and eating more fresh local fruits and vegetables. It encourages the public to support development of safe spaces to walk and ride bikes. The San Luis Obispo Council of Governments and the Planning and Building Department are two of the many partners in this initiative. The Planning Department invited public health staff to provide input to the Climate Action Plan and seeks review of development plans and projects from a health perspective. Our office developed this booklet, Climate Action for Health, Integrating Public Health into Climate Action Planning, as a resource for public health departments wanting to help their communities' climate action plans and other land use or transportation plans address health and equity considerations. It's available on our website. As Michael said, the forthcoming general plan guidelines from the Office of Planning and Research will provide guidance to local jurisdictions on incorporating climate change, health, and equity into general plans, called comprehensive plans in other states. Other planning endeavors with climate change and health implications include long-range community visioning and goal setting, plan making including specific plans, pedestrian and bicycle plans, transportation plans, plan development, hazard mitigation plans, development and design standards, policies and incentives, permitting, and plans for public investments in infrastructure services, as well as sustainable community strategies through SB 375 here in California. Health is a strong motivator for action, and a health frame can unite disparate parties around climate change strategies that have health benefits. Public health professionals can use your trusted role to promote equity as well. I encourage the health professionals on the webinar today to look up your local land use and transportation planners this afternoon and make an appointment to hear what climate change related planning is going on if you don't already have those connections.
Great, thanks, Linda. I think one thing, we're going to actually hand it over to Susan, but I'd imagine that those climate and health reports are really helpful. Can those be found online? Are those available on the California Department of Public Health website?
They are. You can look up the Climate Change and Health team and the CalBRACE website. They're not quite finished yet. They will be posted within about a month or two. We're putting the finishing touches on them and getting final approvals.
Fantastic. And Susan, I am handing over to you, and it looks like you're up and running, so we'll let you take it away.
So great. So thank you so much for letting us be here today. Before I begin, I would like to acknowledge my colleague, Demetra McBride from the Office of Sustainability, who is planning to be a co-presenter, but unfortunately was not able to be here. So today I'm going to talk briefly about climate planning in Santa Clara County and how several county agencies, including the Public Health Department, collaborated on these efforts. Our planning process is built on one another, allowing us to leverage resources and strengthen our relationships within the county. For those of you who are from other parts of the state and aren't that familiar with our region, Santa Clara County sits at the southern end of the San Francisco Bay. It's a fairly large urban suburban county with about 1.8 million people, and there are 15 cities. San Jose is the largest with a little over 1 million people. We also have a sizable mountainous region and lots of open space, and a fairly large agricultural area in the south part of the county. And situated in the Silicon Valley, we have a well-educated, highly diverse population with a high median income. But we also have some significant health disparities and inequities, which are being exacerbated by the high cost of housing and long commutes. A couple of examples: childhood obesity is as high as 44% in Gilroy and as low as 15% in Los Gatos. And smoking rates range from 32% among Filipino males to 13% among white males. Like most counties in California, Santa Clara County will be vulnerable to a number of climate variables. According to the Office of Sustainability, the top 5 are sea level rise and riverine flooding, extreme heat, wildfires, drought, and air quality. Climate planning in Santa Clara County has been a collaborative process from the very beginning. The Public Health Department first became engaged in climate planning, something totally new to us, in 2008 when we were invited to be a part of the County Climate Action Team. This team helped to create a climate action plan which focused on reducing greenhouse gas emissions in county operations and facilities. The plan was created in response to our board signing on to the Cool Counties Climate Stabilization Declaration in 2007, which established a set of aggressive goals for reducing the county government's greenhouse gas emissions. In 2008, the Public Health Department also participated in a training of local city planners on the health impacts of climate change. Since that time, Public Health has been a part of a number of other planning processes that have climate change components or are entirely focused on the issue of climate change, including the creation of a general plan health element, the Silicon Valley 2.0 Climate Adaptation Project, and a Public Health Department strategic plan. In 2009, we started work on the County General Plan Health Element. The scope of the health element includes the entire county, not just the unincorporated area, and its strategies and policies involve many implementers and partners beyond the county government. It was also meant to serve as a model for other jurisdictions and as a complement to our Public Health Department's efforts to support the 15 cities and many community partners in the county working to create healthier, more livable environments. Our Public Health Department, particularly the Center for Chronic Disease and Injury Prevention, has placed a heavy emphasis in recent years on policy and environmental change work to increase active transportation and improve access to healthy local food, both of which have co-benefits for health and climate change mitigation and adaptation. In order for us to do this work, we've tapped into various CDC grants and state and regional transportation funding grants, and we've also received county general funds. Our primary collaborator and great partner and the lead agency on the health element is the Department of Planning. We've also worked with consultants, Ramey and Associates, and multiple partners, including other county agencies and departments, one of which was the Office of Sustainability, which was formed in 2010. The health element, which was finally adopted by the board in August 2015, has 9 sections, which are listed on the slide. Climate strategies and policies are included in the section on air quality and climate change. This section addresses both mitigation and adaptation and includes 4 major strategies: to improve air quality through regional and local land use, transportation, and air quality planning, to reduce health impacts and increase resiliency to rising temperatures and extreme heat events, to increase awareness of vector-borne and other infectious diseases resulting from climate change, and to increase investment in readiness and coordinated planning to meet expected needs in serving more vulnerable populations. In 2012, while we were in the middle of creating the health element, the Office of Sustainability received a grant from the Strategic Growth Council from the state for adaptation planning, and it initiated a project called Silicon Valley 2.0. Silicon Valley 2.0 also included multiple county agencies and stakeholders. It resulted in the creation of a decision support tool that identifies assets threatened by climate change and the magnitude of economic impacts, and it also resulted in an adaptation implementation guidebook. The Sustainability Office worked with consultant AECOM and with Ramey and Associates as subconsultants on the public health sector. As I just mentioned, Ramey was already working on the health element, so we were able to combine our efforts. Ramey staff worked with our newly created Public Health Department Climate Work Group to develop 13 public health adaptation strategies for the Silicon Valley 2.0 guidebook and a climate action plan for our Public Health Department for programming and operations. And out of this process, we developed measurable climate change objectives, which were included in our new Public Health Department strategic plan. We're now working to implement the strategies in the strategic plan. And for instance, the Epidemiology and Data Management Unit and the County Information Services Department have developed a social vulnerability index that will help emergency managers and planners identify vulnerable populations in the county at a census tract level. The preparedness group is incorporating climate adaptation data and best practices into county preparedness plans. The Center for Chronic Disease and Injury Prevention has conducted a commute survey with Public Health Department employees to obtain baseline data as a first step in our efforts to create transportation mode shift among our own 450 department employees. And we're planning a traffic demand management workshop for April to highlight the work being done by cities, including Palo Alto, to increase the use of alternatives. And then next week we will be collaborating with the Barhai Built Environment Committee to provide a training for Public Health Department managers on climate change. Barhai is the Bay Area Regional Health Inequities Initiative and representing the 9 Bay Area public health departments. So with a focus on vulnerable populations, the Public Health Department Strategic Plan, the Silicon Valley 2.0 Adaptation Project, the health element of the General Plan, and the forthcoming Sustainability Master Plan together form an implementation path to identify and map high-risk communities and assess the impacts of climate change, to identify strategies, measures and prioritize resources for the most greatly affected, to increase public awareness and train medical, public health, and other professional staff, to expand coordination to include preparedness units, and to take action that mitigates emissions, promotes health, and increases social connectivity. I'll just end with some of our URLs from our county websites. So if folks are interested in getting more information on what I have just spoken about, and I'll hand it back to you, Elizabeth. Thank you.
That sounds great. Thanks, Susan. And Michael, while we're switching over to Gil, I actually had a question come up for you. And another question came in that we're going to actually save for all of the speakers. But Michael, what was your question?
Hi, Susan. Nice talking with you again. We typically hear about the difficulty of implementing good planning documents, oftentimes because of the cost of implementation, but also the logistics and the partnerships required. Are you seeing the implementation of Silicon Valley 2.0 and your other work in the county as Does it look like it's going to be successful at this time, or do you think there's some gaps that need to be filled from a resource and funding standpoint to make that work? And I know this could be a really long answer, so maybe the short answer.
Right. Well, I think, as I said, we're with some of our work, we're going ahead and using our existing funding sources and our general plan funding for the public health department's part of implementation, but we definitely could use more resources because we don't, for instance, we don't have a dedicated, within the public health department, we don't have a position for climate change. I mean, I actually do this along with other things I do on active transportation and healthy food. So I think we definitely could use more funding, and but we are, with our general plan health element, we are planning to track our implementation on that. And I can't speak for everything with the Office of Sustainability, but I think definitely we can use more funding for implementation.
That's great. Now, hopefully, I think that some of the funding conversation will come up a little bit more when we open it up to further discussion. But I think that, again, to Michael's point, getting the implementation, getting the projects in the ground is really key. And I think from the city perspective with Gil, we'll get into that a little bit more as well. So, Gil, we have you up on the webinar, and we're actually going to go ahead and hand it over to you.
Okay. Thank you, Elizabeth, and thank you, everybody. Good morning. I'm the Chief Sustainability Officer for the City of Palo Alto. For those of you who are not familiar with it, it's in the San Francisco metropolitan area, actually in Santa Clara County. As Susan just described, it's the north end of the county. It's a city of 66,000 people, but let me qualify that. 66,000 residents. Our daytime population is 148,000, and therein lies some of the challenge around climate and transportation and some of the health effects that you've been hearing about. We've been working for the last year and a half with consulting firm DNVGL and Rocky Mountain Institute to develop a new sustainability and climate action plan that will be going to council in the middle of April. So what I'm giving you here is a preview of some of the proposed elements in that plan. These are not yet adopted as policy, of course, but that will be coming over the course of the coming months. So for us, this is not just about climate and environmental issues, but about a safer and more sustainable and prosperous and resilient community. Palo Alto has long been a leader in sustainability and wants to do its part in facing the climate challenge and also inspire other communities by example, because there are some moves we can make here, given both the prosperity of the community and the fact that we own the only full-service municipal utility in California that lets us experiment in some ways that may not be available to other cities. And in fact, the opportunity to learn from each other is one of our biggest assets here. You saw this slide in Michael's deck before. The West is getting drier. The last 100 years were the wettest in California in the last 2,000 years. And that suggests that we may be looking at a new normal. We're seeing much more irregular weather, which has impacts on things like a public utility, which we operate. In terms of weather-related outages. And of course, there's a matter of sea level rise where we may be looking at 1 foot to 2 feet by mid-century and perhaps 3 feet to 5 feet by end of century, according to some estimates. And these pose enormous challenges in terms of public safety, flood control, land use, and in our case, a regional wastewater quality plant that is in that potential flood zone. So some real challenges about what to do and how to do it. And so some of the challenges we're facing are seen by people as impossible because we've never faced the challenge of decarbonizing an entire society in a matter of decades before. But we know both as a society and certainly in this region in Silicon Valley that we've done many impossible things before once we set our mind to it. The leadership in this work internationally has really shifted to cities. There are goals that have been set at national and state level, but really out front all over the world you see cities setting very dramatic goals. Highlighted in green, Melbourne and Copenhagen are blowing past the California goal of 80% reduction by 2050 to look at 100% elimination of greenhouse gases by the middle of the next decade, a tall challenge. For us in Palo Alto, we're looking at an 80% reduction by 2030. I mentioned that the city's got a long history of sustainability leadership. I'm not going to read through the things on the slide here, but you get a sense of actions over the past several decades. thoughtful, strategic, economically vetted, accepted by our citizens. One example is the Palo Alto Green you see in the second bullet. This was a voluntary opportunity for people to pay more for their electricity in order to mitigate its climate impacts. Fully a fifth of the city subscribed to that program, and then the city council said, let's do this across the entirety of our electricity portfolio. And here you see dramatic greenhouse gas reduction since 1980. The large green block at the left was the electricity emissions. You see that it's gone on the right. And that opens up our opportunities for us to think about, for example, shifting natural gas, the red on this chart. Shifting natural gas uses for heating homes and offices, heating space, heating water, cooking can be potentially shifted to electricity, therefore reducing emissions even further. The blue block on these charts is transportation, and that's about 61% of our remaining footprint. Susan talked eloquently about some of the multifaceted health and other impacts of our transportation conundrum. Here in the Bay Area, we have the second worst traffic in the United States. Terrible congestion, which affects not only health, but also economic well-being and the ability of our employers to recruit and retain employees who just aren't willing to drive as far as they need to drive. So the challenge that we're looking at in the conversation we're opening up with the council is, can we move from carbon neutral electricity, which we already have, to being a carbon neutral utility and eventually, potentially, a carbon neutral city? The working target we're looking at is 80% reduction by 2030, and we're already, about more than a third of the way there. With a history of activity from efficiency gains, our carbon neutral electricity takes us to about 35%, the middle of this chart. Business as usual, we think, the existing policy mechanisms in place from the state and federal governments will take out another 60,000 tons by 2030. Measures that the city has on the books will take out another 60,000 tons or so. And our budget then to get to this 80% target is to take a big bite out of mobility, a big bite out of energy use in buildings through both efficiency and electrification, and to continue on our zero waste goal, city shooting for zero waste by 2023. To summarize a climate plan that has in it probably several hundred different measures, but here are kind of the big efforts. The target, as I said before, radical resource efficiency in every dimension of the city's lives. We have a green building code and energy reach code ordinance that we update every 3 years in parallel to the California building code updates, and our commitment is to have set the Palo Alto code 10 or 15% more rigorous than the states. The states is already the most rigorous in the United States. It keeps getting ratcheted up every 3 years in accordance with the governor's directives, and we're trying to stay ahead of that. Second, we need to reduce the subsidies that encourage activities that we no longer want to encourage. Palo Alto is one of many cities in Santa Clara County that have a policy commitment to reduce dependence on automobile, but a policy on the ground of providing free parking. So there's a disconnect there, and there's one of many disconnects we face. The cost to the public is about $3,600 per year per parking space, and the question that's now on the table is that the best use of public funds to meet public policy objectives? But charging for parking by itself is not enough. You don't get there with sticks and without the carrots. And so the fundamental challenge is, how do we make it more convenient for people not to have to drive? And I'll say more about that in a moment, but this is really one of the core levers in the strategy. Accelerating building stock upgrades we talked about, as well as shifting natural gas to electricity. And within all these is building the resilience of the community to be able to respond to and adapt effectively to changes that we know are coming, but we don't know when and we don't know how big, and yet we need to act now to address them. And last but not least is to embed sustainability in all of the activities and operations of the city government as a kind of we go first example to the businesses and community members here. Recognizing that we have different zones of control. Some things like city operations we can just dictate and do. Others are a matter of regulation and influence and collaboration with other regions. I'm going to skip through this in the interest of time and just point, I talked about making it more convenient for people not to drive. Here's the four-pronged strategy there. Emphasizing mobility as a service. You have encountered this already with things like Lyft and Uber and Ride Scout apps on the phone. The vision there is a single application on a smartphone that gives people access to every transportation mode they might need, and the ability to plan, book, pay, and ride in one spot without having to have multiple accounts. We see pieces of this already. We think that has a potentially very large impact on transportation demand, and we'll see how that unfolds. Mobility-friendly cities you've heard about. We're encouraging people to think about the right vehicle for the job, or the day, not the right vehicle for their lives. And we face the imminent prospect of self-driving cars, which can have multiple impacts on transportation issues as well as public health and economics. The challenge we face in all this is that we can no longer do extrapolative planning, projecting from how things have been in the past to how they will be in the future, because the trends are changing very dramatically. Aspirational planning says, let's meet a big goal of 80 by 50. We think one of the powerful tools is normative planning, which is to stand in the successful future, as NASA did in the Apollo project 50 years ago, and ask, how did we get there? Actually reverse engineer the challenging trajectory from the future to the past rather than the normal way we do it. And this is critical because the trends are changing. Vehicle miles traveled, the central metric of transportation planners, has been rising continuously for decades. We tend to plan to build roads and transit and parking capacity based on those trends, but as you can see here, the trends are starting to turn down. As millennials buy fewer cars and as people shift their transportation habits in the face of the challenges before them. Prices are dropping dramatically in many key technologies. ExxonMobil's projected price for batteries in their 2040 strategic plan is going to be reached in 2021. So how do you plan in a world where all of your assumptions are changing that fast? There's for batteries. Here it is for electric vehicles dropping rapidly. This year we'll have cars from Tesla and Chevy, electric vehicles that are competitive, price competitive with comparable gasoline-powered cars. How do you plan? And back in the 1980s, AT&T predicted the cell phone market. That's the flat line at the bottom. A McKinsey analysis for AT&T, and the reality, of course, was far different. So as planners, we have very difficult challenges of planning in the face of uncertainty. We cannot wait to see these trends happen because then we're too late. We can't bet all in on an assumption of what the trend is today because we might bet wrong. So we need an agility and flexibility in planning to be able to move powerfully in uncertain times. And we think the key elements there are to set really clear, strong directional goals, as California has been doing, establish clear principles and criteria for how we'll make decisions as we move toward those goals. And really key is to have flexible platforms so decisions we make today don't lock us out from decisions we might need to make in 2 or 5 or 10 years. So these are some of the design principles that we're bringing forward to our City Council in a few weeks to focus on what's feasible now, but recognize that things are changing rapidly. To emphasize the use of ambient resources, the sun and the rain that fall on the community. Even in a city as dry as Los Angeles, half of the current water demand can be met by the ambient rainfall. Astounding figure, but if you think about the fact that 80% of the city is paved, most of that rainfall is going down the drain and out to the sea. How do you do urban planning in a different way that can capture and use ambient resources? And then really critical for us in our operations to date has been introducing the concept of full cost accounting, looking not just at the first cost or the least cost to procure something, but the life cycle cost over its entire life. And when we do that, we can justify a policy that says electric vehicles first in the city fleet. The vehicles cost more to buy, but they cost $5,000 less per vehicle over their lifetime to own and operate. So that's really critical, aligning incentives and the flexible platforms that I spoke about before. Decision criteria will include traditional measures like financial metrics, but also impact on greenhouse gas emissions, impact on quality of life, impact on future generations, which is a policy exploration that we've begun in this last year to understand what we make today affect 1, 2, 3, 5, 7 generations out into the future. And I'll close with this lovely quote from Tim O'Reilly. As we're often challenged by our colleagues, well, wait a minute, that seems impossible. Colleagues have said, can you prove to me that we can achieve these goals by 2030? And the answer is, of course, no. Is there any area in our lives where we can prove what will happen by 2030? But let's take some bold steps in the right direction and see how well we do, and then recalibrate and revise every few years. So I'll leave it there.
Thank you, Gil. That is fantastic, and I think a really inspirational note, again, recognizing that we have a lot of challenges coming up our way. We have a few minutes for questions, but before we open it up to the group, one question that came in very specific is, will your mobility app include carbon costs so people can compare impacts from different transportation choices?
Yes.
All right. Well, that was an easy. That was easy.
It could potentially include also personal caloric benefit. And so we're in an exploration process with vendors right now to look at how to put that together as quickly as possible.
Okay, fantastic. The other
but for the region as a whole.
Okay, perfect. And the other question that came in is Palo Alto moving or planning more housing to reduce the daily commuting to Palo Alto?
Palo Alto is discussing that, and as you might imagine, it's one of the more controversial political topics on the agenda here. Some people want more housing, some people decidedly don't.
Right.
And so there are clear climate benefits for doing so. There are public health benefits, as some of the prior speakers spoke about, of more bikeable and walkable communities. But how much, how fast, how, where, and where is, is a challenging political dialogue that's underway in the community.
Right. Another question that came in is, how, this was directed at Susan, but I think it's important for all of them, is how, all of our speakers, how did you do stakeholder engagement for these kinds of questions? Like, how do you explain the importance? A lot of folks aren't necessarily thinking about climate change in their day-to-day lives.
Well, we've done a fair amount of outreach. We've had advisory councils, community meetings, a 300-person climate summit a couple of months ago, several rounds of polling that engaged hundreds of citizens, newsletters and the like. It's still, the challenge that it only touches a fraction of the community. I expect that we'll hear from a lot more people once we start bringing plans forward to council. But that's really one of the hardest parts of this work, is getting enough information out to enough people to support people to have a meaningful conversation about this. We've got the moving target of both the trends in the world and this wealth of resources coming forward from the state and the county. I learned about things today that I didn't even know about. We got the siloization in our institutions. We got regulatory constraints at state level that prevent us from doing some of the things that we think would be beneficial. I'd love to talk with OPR more about that. And just, you hear it from all of our presentations this morning, the sheer range of topics that's included under this agenda is kind of mind-boggling for a lot of people. So, finding the best ways to engage people about this is really key. We will be starting a pilot this spring called Cool Block that will bring together neighbors on 10 blocks around the city to think and work together about what they can and want to do in their own lives to mitigate climate change and improve the quality of their lives. If that goes well, we'll expand it to 30 cities citywide. As a way to get that kind of face-to-face grassroots engagement, innovation is really going to come from.
That's great. I'm looking at the time. It's 12. We have a number of great questions. If people need to drop off the webinar, that's fine. But I think just to take a couple more questions, I hope our speakers have time. Oh my goodness, so many questions. One is the question around equity and vulnerable populations. So one question specifically around Palo Alto, but I think this also, building off of Linda's points, is also pertinent for Santa Clara. So what are some of the things that you did to really think about the vulnerable communities? Susan, you're unmuted if you want to chime in as well.
Well, as I said, our epidemiology group is working with our mapping group in the county, and we're in the process of developing a vulnerability index for the county, and that's one of the issues. I mean, that's how we, as Linda framed it, that's how we see it too. It's actually in our strategic plan. Our climate change objectives come under the equity priority in our strategic plan. So we are looking at that. But in terms of the issue of stakeholders as well, I wanted to say that, you know, as I mentioned, our county is 15,000 employees, and just the first step for us is the stakeholders is making sure that our own county agencies are all participating, and within our own health department that people are understand the importance of these issues. So we're really at the beginning of educating our own public health department employees, but we will be framing it within that context of equity all along.
Can I chime in on that question? This is Linda with the Climate Change and Health team of the Office of Health Equity. And you know, we are seeing communities facing and feeling the impacts on their health of climate change right now. So, for example, in Tulare County and Mariposa County, there was a survey done about people and the impacts on their health of the drought, and they found that between 10 and 20% of those residents are already feeling health impacts from the drought as of this fall, and between 8 and 26% of them are acutely stressed. So we're seeing mental health impacts of the drought, of dead and dying trees, of which there are 22 million in the state. And so people are really feeling the impacts already, and they know how that affects their lives, and they're willing to contribute to the solution. So I would really encourage folks on both the state and local levels to reach out to local public health departments, because they often have really deep roots in the community, and also to reach out to neighborhood groups, nonprofit groups, grassroots groups that will be ready and willing to engage on these topics. And if we do robust stakeholder engagement in the evenings, provide childcare, interpretation, food, couple them with existing cultural activities, we will, I think, get a lot of great solutions that the people on the ground have already thought of, because it's affecting their lives right now.
That's great. Michael?
Yeah, and from the state standpoint, we've been really challenged to reach out to the thousands of environmental justice and equity groups around the state, just because it's a large undertaking to access so many groups that oftentimes don't talk with a single voice. We had a challenging situation in 2014 at the first California Adaptation Forum, where we attempted to provide a voice on the equity environmental justice perspectives around adaptation, and we did not do a very good job at that. So as a part of our 2016 Adaptation Forum, so quick plug, September 7th and 8th in Long Beach, California, CaliforniaAdaptationForum.org, we've actually developed an entire advisory committee around just equity, environmental justice, and climate justice to help inform the program, the agenda, speakers, etc. And I think that's a transferable experience to many efforts that's happening at the local and regional level as well, is creating an opportunity and a voice for the environmental justice and equity community to come in and have a safe place to talk about some of their issues and how they connect to the larger priorities of the community as they plan for the future. And we also did a similar effort with the general plan guidelines in building environmental justice and equity outreach components into the dozens of outreach workshops that we had as a part of the draft general plan guidelines.
Yeah, and I think that's it's a key. We actually, which I don't think we've necessarily done before at the state level, we ended up partnering with the California Pan Ethnic Health Network to really bring in a lot of the grassroots and grass tops organizations, as well as community members, to be able to provide direct feedback on the plan. So that's great. Looks like we have a number of other questions, and I want to, as long as people can stay on, it's great. We have a question here. It says a lot of people think that what we eat and the energy it takes to produce meat has a far greater impact on fossil fuel energy and water use in vehicles and transportation. Are there any groups that are looking at this to include food systems for what we eat? So what do folks think? I know there are a lot of folks working on food systems, but maybe I'll hand that off to the local government folks on integrating food systems work.
Well, we are doing in Santa Clara County, we do quite a bit of work with local food issues anyway, but that also has benefits for climate change. We you know, we are trying to increase, in terms of equity, we're trying to increase access to farmers markets for people on food stamps, for instance, on EBT. And we're trying to access, our own county now has a community supported agriculture project where we can, you know, we can purchase fruits and vegetables from local farmers in our county, and we've had that for several years. So we are we are trying to and we're active in our own food systems alliance in the county. So there are many, and we're promoting access to local gardening and mobile food vendors and these issues. We're supporting these things. So these things are happening anyway as part of increasing access to healthy food, but it also helps people purchase locally, not as many miles traveled to, get the food and that sort of thing.
And at the state of California, we have and this was on one of my prior slides, which will be posted within the week, but we have a section on natural and working lands, and a big component of the working lands piece is what are the emissions from various different types of agricultural production, how do we reduce those emissions over time, and certainly part of that discussion around working lands is how do we inform society and our population to make better decisions around food products, and the discussion on food deserts have come up, urban agriculture has come up. There are a lot of interconnects there, and there's also a direct connect back to not just from the emission side, but also on the adaptation side for the agriculture discussion. Many of the things that we can do to reduce the impacts of the greenhouse gas emissions impacts will also increase the resilience of our working lands and the soils that provide us with food.
Yeah, and something came in. So Henrik Boell Foundation, it's HEINRICHBOELL Foundation, has a meat atlas with a lot of great information. It looks like, just for time, we'll maybe take 2 more questions. One came in that a lot of governments just don't have a lot of free time. So what strategies do you recommend to help re-engineer some of our existing processes to better embed these issues?
In 10 words or less?
in five words or less.
I'll be real quick. So this is Michael. At the state level, we did an exercise a couple years ago to reach out. We had about a dozen workshops around the state trying to understand why local governments and regional groups weren't able to move forward on initiatives. And 3 of the big things came to mind. One was capacity, just the inability of staff to have the capacity to do the work needed to move forward. Another one was the financial side of things, and the other one was technical resources to do that work. So we've been actively working over the past few years to help bring those resources to the table. The Civic Spark AmeriCorps program is one way we've tried to build capacity for local governments. We've attempted to bring together the tools that are needed through the general plan guidelines and other advisories in partnership with other state agencies, including the Department of Public Health, to provide resources like the Health and Climate Action Plan document, which OPR also participated in. It's a valuable resource that proves efficiency as we think about how to plan in our communities for these issues. And Gil, I think you were next in the queue.
We feel the capacity issue sorely. Our staff is very fully committed, before even taking on these issues. And we're trying to figure out how to leverage our existing resources as best as possible, and also how to expand that capacity. It's clear that communities, local communities, counties, and state are going to need to make investments in support of these changes. I think the good news, as we've heard from Michael and Susan and others, is that many of these investments have multiple benefits. So it's not just an investment in less congestion, but also better health, and also less greenhouse gas emissions, and also public safety. And I think part of the challenge is that we're not very good at analyzing investments that have multiple impacts. We tend to treat things as discrete activities one by one. It's certainly one of the challenges we have in relation to energy planning with the California Energy Commission. We can't book the benefits for some of the strategies that we see the benefits of. So I think there's both some resourcing questions at local level, and regulatory and policy and organizational questions at institutional level. On the resource question, we think there's a lot of opportunity here for public-private partnerships, for programs that are designed or driven by local government, but are actually financed and in some cases operated by third parties, and it gets you into tricky questions about outsourcing that need to be addressed carefully, but also questions about what are the best roles and the best skills and capacities of governments compared to what other institutions can do. So I think that's part of the team effort that we need to put together on this very big challenge.
Can I chime in on the resource question as well? This is Linda. And we really love it for planners and public health folks on this call to work together to get some more funding. The budget for the cap and trade funds this year, the Greenhouse Gas Reduction Fund, is $2.2 billion, and next year is projected to be $3.4 billion. So folks can work together to apply for programs such as the Affordable Housing and Sustainable Communities grant program that has the goal of reducing greenhouse gas emissions through projects that implement land use, housing, and transportation strategies to support infill, compact, and affordable housing development. And that has a rural set aside, and it prioritizes disadvantaged communities, and applicants get points for community benefits, including improving public health and safety and partnering with the local health department. And then there's the Active Transportation Program, which is not part of the Greenhouse Gas Reduction Fund. And that includes now the Safe Routes to Schools program, and public health departments can be applicants. There is also a portion set aside for disadvantaged communities, and that program is aiming to increase biking and walking through active transportation plans, infrastructure and non-infrastructure, including Safe Routes to Schools and other things to encourage biking and walking. And then there's some new proposed programs in the governor's budget, including $100 million in the Transformational Climate Communities Program, which would reduce greenhouse emissions through active transportation, and other cross-sectoral strategies such as investing in energy, transportation, urban greening, land use, water efficiency, waste reduction, and other activities to provide job training and economic benefits. And there's just a lot more. I encourage folks to look at the proposed governor's budget. And then finally, weatherization, upgrades, and renewable energy programs are available right now through local organizations that contract with the state community services and development department. And those help low-income communities in single-family and multi-family units to do weather, including weather stripping, insulation, etc., window replacement, refrigerator replacement, heating, cooling systems, and also help to install solar, hot water, and photovoltaics.
That's great. Well, I think just for time, we actually have more questions. So one of the things we'll do is actually work with our speakers to answer these and put them on the LinkedIn page is probably the best place that we'll answer these questions. It was really a fantastic dialogue and discussion. I want to thank all of our presenters, and actually our next, since the question came up around food systems, our next webinar will be on food systems, so please stay tuned for that. And thank you again for joining, and I hope you reach out to your colleagues and make new connections. To leave it on what Gil said, accomplishing impossible work, but it is impossible. So thanks everyone, and we look forward to the next webinar.
Thanks so much, Elizabeth. Bye-bye.
Bye.